Okay, thank you very much, Piraya, and thank you very much for everyone to attend this webinar. I just want to introduce our two speakers. Both of them are the new generation of the informatics in Thailand, the young blood for the next generation. And we do this research together in the past year. And we hope that our research and finding can help the Thai healthcare system. And also we would like, we think that this can be kind of the knowledge that the other country can look at, and we are really happy to share the knowledge. Now, let me starting with Dr. Anawat, please. Over to you, Dr. Anawat.
Okay, thank you. So I will start sharing my screen. Good evening, everyone. First, I have to say thank you to you all that spend your time here, and thank you to Asia eHealth Information Network for giving us an opportunity today to present. And today we are going to present our research about digital health governance model, a recommendation for Thai health system. My name is Anawat Rasathorn. As introduced before, I am general practitioner based in Thailand, and I'm now studying a master degree in biomedical and health informatics at Mahidol University. And another speaker today is Dr. Kamunporn Suwantavimisuk. She is a family physician and a lecturer at Jakinarabudin Medical Institute. We are both a research assistant for this project that led by Dr. Bunchai Kisnayotin and Dr. Thiam Angsachon. And okay, now let's move to the content. First, I will start with the very brief background of why we need to do this research. Back to the year 2010, the Ministry of Public Health, Thailand, and World Health Organization reported that digital health governance was an essential foundation for established e-health in Thailand. The essential foundation had 4 factors. The first factor is the governance mechanism, which comprises many stakeholders. And the second factor is legal issue about data security and privacy. And the third factor is health data standards, which leads to interoperability. And the last factor is solid strategy and plan about workforce development. And in this research, we focus on the first factor about governance mechanism. The governance mechanism comprises many stakeholders who have contributed to policy and effective health information technology development. And now in 2022, despite a decade of determination to develop the governance mechanism, there is still no consensus among stakeholders on our national digital health governance mechanisms. Hence, we started doing this research about digital health governance model. So the objective of this research, this research aimed to identify a digital health governance mechanism that suits Thailand the most. And we also aim to propose a policy recommendation that's aligned with the context of Thailand's health systems. This is a brief methodology in our research. So our research have 2 parts. The first part, we review literature, including digital health governance and health system from international reports, especially the report from Broadband Commission for Sustainable Development and WHO ITU. ITU stand for the International Telecommunication Union. And we also study various digital health governance models from 6 countries, including Malaysia, Philippines, Australia, England, USA, and Canada. And in the second part, we performed a descriptive qualitative study design that we use a semi-structured in-depth interview method. we did the interviews with 11 health information technology scholars, executives, and startup entrepreneurs. We did the interview by both face-to-face interview and also did online interview. And after these two steps, we extracted insight from the information that we gained from two steps, and we synthesized the policy recommendation. That's about our methodology. And let's go to our result of literature review. Okay, first thing that we want to find out in this research is the definition of governance. So we find out what is governance. We review the definition of governance from many sources, such as Thai Royal Dictionary Institute and UNSCAP, and also from World Bank. We found that there were different definitions among many sources that we review. So we can say that there is no universal definition of governance. However, it's widely considered that governance is not equal to government. Governance has a broader scope than government, which means it includes public and private sectors. And governance is not commonly considered as management, since governance is defined at a higher level than that. Governance is defined in the same level as vision setting, direction setting, resource allocation, and also risk evaluation. Moreover, governance is focused on process that leading to a decision. Governance leads to decision making, whether decisions are executed or not executed. Furthermore, we found that the UN, the United Nations, provided some suggestion about good governance, which has eight major principles, which are accountable, transparent, responsive, equitable and inclusive, effective and efficient, follows the rule of law, participatory and consensus-oriented. These 8 principles are characteristic of good governance that defined by UN. And now, after that, we try to define deeper into what is digital health governance. We study the meaning of digital health governance from a report that named A Call for Government Leadership and Cooperation Between ICT and Health. The report was published in 2017 by the Broadband Commission for Sustainable Development and WHO ITU. We consider the meaning of digital health governance is quite related to the meaning of governance that I mentioned in the last few slides. Digital health governance means the mechanism and process of decision making that lead to system implementation and also not implement in some situation in a digital health system. Digital health governance is the method of applying authority to direct vision, process, resource allocation, and also to risk evaluation. That is involve all stakeholders in the system. And additionally, we found that digital health governance is not the same as digital health data governance, which the later one is mainly focused on health data. We can see that digital health data governance is subset of digital health governance. So digital health governance is broader than digital health data governance. Is cover all aspects of digital health. Okay, that's all about the word governance. We define the meaning of word governance and also define the meaning of the word digital health governance. And now we find out deeper into each model of digital health governance. Okay, this is how the digital health governance is approached. This picture summarizes governance continuum. The governance models are various depending on different contexts. There are the first one that they are fully regulated, which is the most centralized and is controlled by legislation and sanction. And the second one is guided market, which combines centralized and decentralized together. And the last one, free market, which is the most centralized and is controlled by cooperation and co-production. From this approach, we have this picture that show three models of digital health governance models. This picture is from the report by Broadband Commission and WHO ITU that they review how many countries govern their digital health system. There are three models of digital health governance mechanism that show in this picture. The first one is Health Ministry mechanism. For this model, the Ministry of Health is responsible for driving the national health strategy. The Ministry of Health also mostly provides technical and financial capacity. The Ministry of Health is a leader to mobilize both technical capacity and skills from other ministries to deploy and implement digital health system. And in this model, other organizations play a supportive role for their specific domain. And this model is the most centralized among these three models. Advantage of this model is the Ministry of Health has a comprehensive view of national health priorities, and Ministry of Health can ensure close alignment of the digital health strategy with the health strategy. It can also reduce the potential for confusion or competition between sectors in the country. However, the challenge in this model is that there might be some struggle in intra-governmental cooperation, but these are some successful cases for this model. Rwanda and Philippines are two countries that successfully implement this model. Philippines has steering committees, technical working groups, and strong program management from its ministries, and also have joint MOU to codify the role and authority of each ministry. So Philippines successfully implement this model. And for the second model is government-wide digital agency mechanism. For this model, Ministry of Health drives digital health strategy and program management, while there is a digital agency that provides shared ICT resources and implementation expertise for all government entities. And in this model, other ministries act as clients to this digital agency. This mechanism provides a common set of standards, policy, and also guidelines, such as interoperability standards, data security standards, cloud services, and also provide technical capacity. And this shared digital agency provides opportunity for collaboration and shared investment across ministries. This model lead to centralization of responsibility to the agency, but common framework and architecture can create some resistance because sometimes some specific requirement may not compatible with the architecture and framework. However, it may be less challenging if Ministry of Health manage the health specific requirement for the ICT system. For this model, there is example case from Malaysia that successfully solved this challenge. In Malaysia, while using common framework of ICT that provided by Mempool. Mempool is the organization which is responsible for digital transformation. But in Malaysia, the Health Informatics Center under the Ministry of Health control health data standards. And the last model is dedicated digital health agency mechanism. The agency in this model is different from the agency in last two model. The agency in this model, in dedicated digital health agency mechanism, operates as an independent unit with dedicated capacity and resources, and it has explicit role in coordinating digital health efforts as a government representative. The dedicated agency developed the digital health strategy with input and guidance from the Ministry of Health and drives implementation with support from other organizations. In this model, the agency can be structured as non-profit third-party agency like Infoway in Canada, or it can be as a foundation like in Estonia, or can be like or it can be a directorate under the Ministry of Health like in Norway, and also can be an independent agency like in Mali and like in Australia. This model, the last model, is beneficial in terms of creating interoperability, and it's also better in terms of continuity through changes in government leadership. However, to separate dedicated agency from the government or separate it from the Ministry of Health can lead to perceptions that the agency lack credibility. This three model is what we used as a reference to do this research, to research other 6 countries. Okay, after we study meaning and concept of governance and different model of digital health governance mechanism, we have researched the digital health governance from 6 different countries, including Philippines, Malaysia, USA, UK, Australia, and Canada. And we found that the digital health governance mechanisms of some countries cannot be clearly classified as a certain model out of 3 models that I mentioned before. We found that the digital health governance mechanism is classified as a spectrum from one side of the spectrum, which represent a centralized mechanism, to other side of the spectrum, which represent a decentralized mechanism. And we also found that a variety of factors such as government system, health system, and also culture can lead to differences in mechanism of digital health governance. For instance, the government system of Australia, which is defined as 3-level government, it's very quite different from government system in Thailand. This factor can lead to differences in digital health governance mechanism. And as you can see in this table, we try to classify each country into most appropriate model. The first country, Philippines, we define Philippines as a health ministry mechanism. As I said before, Philippines has steering committees, technical working groups, and also has strong program management. The steering committee in Philippines is chaired by the Secretary of Health and co-chaired by Secretary of Science and Technology, and includes the President of Field Health and the Chancellor of the University of Philippines, Manila. So we define Philippines as the first model. The second country that we researched is Malaysia. Malaysia has the Malaysian Administrative Modernization and Management Planning Unit, or MAMPU, that I mentioned before. MAMPU provide ICT guidance and infrastructure to modernize our public sector. And MAMPU also established national ICT policy. And in Malaysia, Ministry of Health provides digital health leadership, strategy, and program implementation. And there is an organization under Ministry of Health, which is a National Informatics Center that's responsible for specific health IT aspects, such as health informatics standards. So we consider Malaysia as a government-wide digital agency mechanism. For these two countries, USA and the UK, these two countries were difficult to clearly classify because their digital health government, their digital health governance is mixed between health ministry mechanism and dedicated digital health agency mechanism. Since these two countries, they have designated organization to oversee digital health. In USA, the Office of the National Coordinator for Health Information Technology, or ONC, is responsible for this. And in the UK, NHS Digital is responsible for this. But these two designated agencies, ONC and NHS Digital, are directly under Ministry of Health and have to directly report and be regulated by the Ministry of Health. Furthermore, these two agencies don't have responsibility to establish national digital health strategy. And in the USA and the UK, there were many other organizations that play major role in digital health governance. So we consider USA and UK as a mixed model between health ministry mechanism and dedicated digital health agency mechanism. And lastly, for Australia and Canada, we consider Australia and Canada as a dedicated digital health agency mechanism. In Australia, there is Australian Digital Health Agency that play the role as dedicated digital health agency mechanism. This agency is responsible for setting digital health strategy, implementation, and they also monitor every aspect of digital health in Australia. And in Canada, the last country, there is Infoway that responsible for that. This Infoway is responsible for every aspect of digital health in Canada. It's similar to Australia. Okay, so in part one, we covered the meaning of governance. We covered the meaning of digital health governance, and we study 6 countries how they governance their digital health system. And next we will continue to the part 2 that Dr. Kamonporn will continue for the rest of the presentation. Okay, thank you.
Greeting everyone. The next section of our presentation is the in-depth interview process, results, discussion, and overall policy recommendations for Thailand. We interviewed 11 health information technology executives, professors, and startups entrepreneurs. They were both face-to-face and online interviews. The total interview duration was 615 minutes, while each person spent an average of 56 minutes in the session. In-depth interview process. We utilized semi-structured questions and introduced our interviewee to digital health governance mechanisms from Broadband Commission Working Group, followed by exploratory research questions. And here are digital health governance models, as Dr. Anawat has mentioned before. With Health Ministry mechanism, government-wide digital agency mechanism, and dedicated digital health agency mechanism. We summarized and interpreted the information in Thai and introduced it to our interviewees. And here are our results. Most participants share similar perspectives on Thailand's digital health system governance. The Ministry of Public Health should not be the sole leader in execution. Many interviewees listed the following as the primary reasons. Healthcare providers and health information technology services to the public consists of many involved parties besides the Ministry of Public Health, such as the Ministry of Interior, Ministry of Digital Economy and Society, Ministry of Higher Education, Science, Research and Innovation, university hospitals, and the private sector, which the Ministry of Public Health cannot oversee. And another reason stated by interviewees was the Ministry of Public Health's lack of expertise in health information technology and lack of personnel. These reasons may impact the country's e-health system's ability to adapt to current medical needs. Most of those polled prefer the dedicated digital health agency mechanism and the government-wide digital agency mechanism, respectively. Some of them supported a combination of those two formats above. At the same time, some backed the combination of the dedicated digital health agency mechanism and the health ministry mechanism. Many interviewees agree that the Prime Minister or Deputy Prime Minister should be the leader of the digital health body because they have the most authority to make decisions civil-wise across ministries and are acceptable to all involved stakeholders. And according to interviews, there are many influencing factors in developing digital health governance in Thailand, such as leadership, heroes and responsibility, collaboration, digital literacy, data governance, health information standards, interoperability, health information exchange, public-private partnership, funding, resistance to change, being an independent organization and clear purpose. As you can see from the figure, we visualize data into a radar charts, giving each topic 1 point every time the interviewee stated one of those mentioned. And here is the same data, which we adapted into word cloud. The top 3 factors influencing the country's digital health governance are: first, leaders of change who have complete decision-making authority and consistently support projects. Second, departmental collaboration to remove work silos and redundancies. And third, health information standards are essential because they provide the foundation for information integration and exchange to benefit from health information ranging from medical services to health system management and research. And our discussion, according to 6 countries' analysis, a study discovered that each country's digital health governance was consistent with its baseline characteristics. A country's government and health system vary from one end of the spectrum with a centralized approach to the other with a decentralized one. Canada is a good example. It's a decentralized country since each provincial government sets health insurance policies. There are like 13 different policies. This is consistent with the country's digital health system, in which an independent agency or Canada Health Info operates with the representatives from each province or territory on the working group, allowing each district to play a role in determining the country's health information technology strategy and decision making. And according to an in-depth interview, most interviewees agreed on the dedicated digital health agency mechanism the most. The key argument for not supporting the health ministry mechanism is that the Ministry of Public Health cannot oversee agencies outside the ministry. And our result of the influencing factors for digital health governance are similar to a recipe for success from Broadband Commission ITU Digital Health Report 2017, which is first, sustain senior government leadership and committed financing for digital health are prerequisites for a successful national digital health strategy. Second, effective governance mechanisms that engage stakeholders who have clearly defined roles can help to ensure efficient decision-making for a national digital health strategy. And third, a national ICT framework that facilitates alignment between health and ICT sectors can promote connectivity and interoperability, establishment common standards, and enable appropriate policies and regulations in digital health. And here are our overall policy recommendations on digital health governance for Thailand. First, digital health governance cannot be executed solely by the Ministry of Public Health. However, the ministry can be a leader in implementing the mechanism of digital health governance. Second, the Ministry of Digital Economy and Society and the Ministry of Higher Education, Science, Research, and Innovation have to play a key role in the mechanism of digital health governance. And third, the mechanism should be collaborative governance with strong leadership. Furthermore, health insurance providers, healthcare providers, health technology entrepreneurs, and the community should all be involved in the digital health governance process. In addition, a dedicated digital health agency mechanism should be implemented. And lastly, health information standards should be prioritized. Anyway, our research has some limitations. It might lack of civil society opinions. And in the literature review, it's the retrospective analysis. The most recent information may have limitations. Thank you for all your participation. Do you have any questions?
Hi, I see Mr. Jai Ganesh raise his hand, so you may introduce your questions, Mr. Jai.
Yeah, thank you, Priya. My question was related to the literature search. Did you conveniently sample the literature or used a specific keyword and source the literature from, say, a particular date to particular date? Or you conveniently chose what you want to pick for the literature? Because this is important, especially from 2019, we have seen a lot of work happening in this important topic of governance of digital health in this region as well as beyond the region. So I'm curious to know more about the literature search, if it is possible to share beyond this webinar, what was searched and then what was the period used, and then was there any specific keyword or resources that were sought? And then the second one is more of a remark, I would say. This came up from a recent discussion with one of the partners of AeHIN, and they beautifully summarized, in terms of governance, there are three things involved. What, that is the structure; how, that is the processes involved; with what, what to govern, and then how do we govern. This is something, if there is a possibility of this study getting extended, maybe this is something that could be considered. And then I felt like maybe more countries could be added, because I do see a bit of countries that is mentioned in the region. One question is we have included some countries and then mentioning about some mechanisms of governance, but is it going by the literature, or is it something that you found this is actually happening? Means these steering committees are actually functional, active, and then there is an active governance mechanism being functional in these countries. Thank you.
Hello, Dr. Adawat or Dr. Kamonmon, would you like to respond?
Okay, I think I can answer the first question, that about the literature review in our research. Okay, in our research, we don't use searching database in database website, but we mainly review in the report by the WHO ITU on governance model and digital health governance model. And for each country in this country, we usually review on official report, or maybe the digital health strategy that they publish on their website. Yes, to do this research.
Thank you for answering this. WHO Euro, that is Europe region, had recently brought out a report which also talks about governance. I've just shared on the chat. Apart from the Inter-American Development Bank, which brought out a report entirely on digital health governance, because they also fund a couple of networks similar to AeHIN in the LATAM region. So that is something that if you are interested in extending the study or updating the study, I think you could consider it. Thank you.
Okay, thank you.
I can add that the answer for Jai. You can see that this research is very specific to find a solution for the Thai healthcare system. We know that there is several a variety of the governance, and one of the issue that has been, arguing between stakeholders. People talking about the governance, but what is really governance and what they mean by the governance and the factor that related to governance, no one have the consensus. And we haven't shown you the overlapping between many minister and also the stakeholder and like the National Health Insurance System, Health Insurance Office, that there is so many things that the activity about the digital health that they overlap and sometimes it's a kind of the against each other. So and there is no kind of the governance that will lead all of these kind of the fragmentation and overlapping. So our research is mainly to focus on how we're gonna recommend the country. With this, the approach that we have done is that we review all the international report from the international organization that already discussing about the governance, and then putting those governance into kind of the structural frameworks, and let those questions go into the key informants of to interview. For example, we interview the ex-minister of ex-vice minister of the Ministry of Health about his governance. He had experience on actual administrating the Ministry of Public Health. And also we interview several ICIO of the hospital in the big hospital and small hospital. And also the people who work at the insurance and the entrepreneur. So all those informants have the experience on this kind of the challenge in Thailand. So you can see that our research, we don't go deep into the journal database. So the way that to get the knowledge that we know about each country's country governance mechanism is from researching or dig down into the report and also the official web page of each countries. And with those dig down into all the information in these several sources, we come together and come up with the analytics, synthesis, how we're gonna interpret all of those findings. And that's why we come up with the table of the spectrum of the three centralized and decentralized things. And thank you very much, Jai. I think your resources is very informative, and we hope that we're gonna look at it and also enhance our finding. Our aim is that we would like to come up with the recommendation, and we to the people who will influencing to create the governance mechanism, and at the same time to create awareness of the multi-stakeholder in Thailand that country don't have the governance mechanism on the digital health. We have to have one. And all of these recommendations is that what we are trying to customize the knowledge that we can find in many countries to the health system in Thailand. Over.
Thank you, Dr. Bunchai. I really appreciate the work that is being done. Again, I'm also not suggesting a very theoretical approach. And the two resources that I suggested both actually pertain to actually a digital health network. And this pertains to what they have suggested with working with the countries in Latin America and Europe as a region. So maybe that's sort of different from the typical journal theoretical articles. And then maybe more countries will also emerge. Right now, Lavapedia, from based on AeHIN experience, Lavapedia as well as Sri Lanka, both are also having the national digital health strategy and the blueprint and the costed, plan. So there are governance structures also emerging there. So it will be good to maybe a good addition to our region. Thank you.
I can add a little bit that because of we got this kind of the small funding from the ICT Center of the Ministry of Public Health, and we have an opportunity to present this to many stakeholders, include the administrator at the Ministry of Public Health. You know, like I said, this is we know the governance is important and it's one of our framework gaps. But the hard thing is that how we gonna create the people in the country awareness that you're talking about the governance, but what is the really governance that are suitable for our country? So we try to come up with this answer, and we hope that with this, the awareness will increase, and also they have some kind of or see the framework of what is the good governance, what should some mechanism of the governance are suitable for the health system of Thailand, or the health systems that like Thailand. Thank you. Dr. Kamonporn, do you have anything to add? Or any question from the audience or discussion?
Not yet, Dr. Bunchai.
Okay. One thing that I'm very proud of with this work is that we can bring more new young blood to come to interested in the digital health. Dr. Kamon is basically, she is a family doctor. She have a pain on the silo system, and why have a question why the information not integrate and transfer. That is the starting point of Dr. Kamon to kind of interested in the informatics. And and this is her works, and Dr. Anawat works that talking with people, and now understand more about the challenge of the countries. And we hope that we are going to work together and to lead, to develop our health system, a digital health system. Dr. Anawat is also a very keen young doctor that would like to be the informatician. And we are in the near future, we hope that we are going to have the keen and people to work on the digital health.
Okay, I think there are no further questions from our audience. So maybe we nearly reached the top of the hour. So maybe Dr. Bushai, could you give some closing remarks for our last AeHIN webinar to this year?
Okay, thank you. I think I really happy that one of our audience, Dr. I think I see Dr. I think Saravanan from Malaysia that very interested in our in AeHIN, and welcome to be the AeHIN member. And we hope that this year we have be able to share knowledge in different aspects on the digital health, and we're gonna do more next year. And we hope that all of you come and contribute to the digital health development in your country and the network. So Merry Christmas and Happy New Year to everyone. Sorry that I didn't open my video because I am outside in the restaurant right now. Okay, then thank you. Bye.
Thank you.
So goodbye, everyone.
Bye.
See
Bye,
you next
Lisa.
year.
Bye.
Thank you. Bye
Thank
bye.
you.
Happy New Year.
Happy New Year, everyone. Thank you.